dysmenorrhea. Okay. Pain relief, you can use Pushanaga. If you need instant relief from the painful menstruation on that day itself, means you have to do your daily based works during that period and you are facing severe difficulty menstruation. At the time you can use the tablets which now I am to use the tab for 3 days. If you are not having pain in second day or third day, you can avoid it. If you are facing uh, dysmenorrhea, that is painful menstruation, in every period, in every cycle, in every month, at that time you have to use one tablet for 3 days continuously. So second is, if you are not getting relief with that, means you can use for this Brufen tab. Brufen tab is a NSAID, that is non-steroidal anti-inflammatory drug. Okay, it will give you instant relief as your abdominal muscles will get spasm during that menstrual cycle. This methyl spasm will give you an instant relief. If it is not happening in your case, at that time you have to use the Brufen. It is a painkiller, non-steroidal anti-inflammatory drug. You have to use one tab for a 5 days. Next, instead of this Brufen, there were many other painkillers like diclofenac and aspirin also, but you have to take care if you are using that aspirin and diclofenac. If you are having any liver problems, at the time you have to avoid that aspirin. And if you are recently vaccinated and with Covaxin or Covishield, at the time you have to avoid this diclofenac combinations and all. So for that sake, I am giving you here only Brufen. Okay, methyl spasm is the first treatment of choice, and the second option is Brufen. If the if you are getting dysmenorrhea, that is painful menstruation for only this cycle, if your previous cycles are normal, then you can take only one methyl spasm tablet on the first day of your cycle. If you are getting frequently, that is if dysmenorrhea, one tab for 3 days. Second thing is you have to use a pain tablet of Brufen of for 5 days. The dose must not exceed 500 mg. I have given you and do's and don'ts regarding this Brufen tablet intake. You can check that video if you need. Next, the third thing is you have to avoid oily foods during that cycle. Okay, next, regular physical activity and sports must be, you have to practice this aerobic and physical activity, but only these 5 to 6 days regarding your monthly cycle. You have to stop this regular exercises and physical activity, as it may cause excess bleeding, causes you pain. The pain will be aggravated, so you have to avoid that regular activities, and you have to improve your general health like doing cardios and all, and yoga. These all will get you out from the dysmenorrhea. And if you need a permanent cure, can take Pushanaga Churna, and for the dose and all you can consult me, because Ayurvedic medicines are not like this allopathic medicines, because here you can give one tab for 5 days, one tab for 3 days, like that. But coming to Ayurveda, it is not such a thing. You have to take care, and I have to know the complete history of the patient before prescribing an Ayurvedic the Shanuga Churna for any kinds of diseases regarding the there is no relief with these tablets which I have said. And if you practice all these aerobic, yoga, and regular physical activities, and even if you are using this methyl spasm and Brufen tablets and vitamin D3 capsules, because of low calcium also there may be chances of getting pain during the menstrual cycle, so you have to use this vitamin D3 capsules. If you are not able to take the tab, means you can expose yourself daily to the sunlight in the early morning itself, and you then this dysmenorrhea will get cured. You can use this, as I have already said, you can use this methylspasm and brufen tablet only for first 2 days. If you are getting pain only one cycle, means your previous cycles, previous monthly cycles are normal, maintain your regular health. If you're getting any kind of relief even after practicing all these things and tablets, you have to consult your near gynecologist to rule out any underlying cause, that is endometriosis, and for any dilatation of your cervix. Next subject like dilatation of cervix and paracervical blocks. If any by you, so like, subscribe, share all your needed ones so that they too will get all these prescriptions. Thank you. Stay tuned. The Ayurvedic remedies for dysmenorrhea be given with individual. The dose will be given as per Ayurveda. So I'll provide you the appropriate dose along with the dysmenorrhea prescriptions in the coming videos.